Hi, I'm Nora Lou Roos, and absolutely delighted to be joining you even in this rather weird world and remotely, and would obviously much rather be there in person. I'm a professor emerita as of July 1 at the University of Manitoba in the Faculty of Medicine, Department of Community Health Sciences, where I have been for decades, since moving to Manitoba in 1973. So my background actually was in political science at MIT, where I did my degree, and through a long sort of process, ended up doing health services research and working on issues which relate to the currently, how do we help people access benefits that they're eligible for? I was hugely honored to be informed that I had received this medal. In many ways, when I looked at the degree to which this medal focuses on service to the community, it really gave me a chance to reflect on my career and decided it's marvelous being recognized for what you love to do. So it was a wonderful thing which happened, and I was just delighted. Well, my career has been, as everybody's career, I'm sure, a very interesting one. When I think back to when I was graduating from MIT, but the first phase of my career was actually finding a job. While my husband had an offer in political science at Northwestern, nobody wanted to hire me. I was a female, blah, 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 blah. I had a great advisor who phoned his friend in the business school, which was just becoming a school of public policy. And so they decided, well, they could hire me half-time and see how it worked out. And it worked out extremely well. I subsequently had it was called a Sears Roebuck Fellowship, and sent me to Washington, D.C. for 3 months, right before we moved to Winnipeg. And there I was working in a health agency, and that put me in touch with health researchers in BC who put me in touch. I was hired in the management school originally at University of Manitoba, but 1973 is when they introduced Medicare and as I was talking to the Dean of Medicine at one point, I says, why did you put together this really interesting community health sciences department in the medical faculty and hired all of us non-physicians? And he said, well, you do realize that that's when Medicare started, and it was good for physicians to have some understanding of what the healthcare system is all about and how it works. What I also figured out when I was in deputy minister's office at one point, or doing some work, was because there was a Medicare program, every time an individual saw a physician, every time they went into a hospital, a record was created. And trying to understand issues about health, this was a very powerful research tool. So I persuaded the deputy minister to go with me to Dartmouth College in the States, where research was going on in this area. And they were impressed. He was impressed, convinced the Minister of Health to be impressed, they set up the Manitoba Center for Health Policy, which I was and my husband were the founding directors back in 1991. And I was the director there for 13 years. I guess the next phase of my career was when I stepped down from being director. I was very interested I sat on the ethics committee, and I was very concerned about problems of getting arm's length evaluation of drug safety and effectiveness. And I got involved in setting up an agency which would operate at arm's length from pharma, funded by Health Canada. And we worked for 3 years with people across the country, and they set up the Drug Safety and Effectiveness Network, DEEPIN, which is based at the Canadian Institute for Health Research, but does safety and effectiveness evaluation at arm's length from drug companies, which I was very pleased about. Next phase of my career, I was concerned about the fact, I was reading the newspaper, and there was an article published which was absolutely counter to what I knew from my research was the evidence on this issue. Started working, turned out that Canadian Institute for Health Research had a grant where if you partnered with organizations, they would give support. And media was one of the organizations that potentially you could partner with. So eventually I did that. We had 5 years of funding from Canadians for Health Research to work with academics to get their research into the media. We published over, I think over 1,000, about 1,200 commentaries or op-eds, opposite the editorial page in Canadian press, Globe and Mail, Toronto Star, Winnipeg Free Press, you name it, Ottawa Citizen, networked 80 academics across the country to do this. Currently, and really coming out of that work, I'm involved with a Get Your Benefits project funded by the Winnipeg Foundation to help people access benefits that they're eligible for. And we've produced a booklet which is distributed through the government of Manitoba, Ministry of Health, Ministry of Education, and over 100,000 of these booklets have been requested and delivered. So that's my weird career. I think founding the Manitoba Center for Health Policy was clearly my big step. But we started out with health data. What for me was really my biggest contribution was when we involved the ministries of education, family services, to include information on employment income, assistance on kids in care, and the research which I was doing at the time, which made it clear how strong a driver poverty is for bad outcomes for kids and families. That, I think, was my sort of biggest contribution. I love this question. It takes me back to one of my absolute best friends, Evelyn Shapiro, who actually set up the home care program in Manitoba. And when she first joined our faculty, and she was never paid, she was a volunteer who taught students, was marvelous. And she had just sort of joined the faculty, and I just had a paper accepted, one of the really high profile journals. I don't know if it was JAMA or what, but New England Journal of Medicine. And I went into her office and I said, Evelyn, I've just had my paper's been accepted. And she looked at me and she said, no, that's really very nice, but wouldn't you like your work to have more of an impact than getting published in a journal? And I think I was depressed for about sort of 2 or 3 months trying to figure out, okay, how do I do something that's more than just getting a paper published? And that really led to many of the other things that I was just describing. It's an interesting question, is sort of what have you sort of learned over the course of this rather interesting career? And one thing which I would absolutely advise is when you're on a committee, whether it's a board, whether it's something set up to do something very specific, have a colleague on that, or identify someone on that committee that you can relate to, work with, and discuss what it is that you want to happen. Because when 2 people on a committee can reinforce each other, it's a very effective way of getting what needs to be done. That would be my first advice. Second advice is to really look for opportunities, given what's sort of going on in the world. And a great example of this just came up with the throne speech that our good premier, prime minister, had announced, where in the throne speech, they said they were going to commit to doing automatic tax filing for simple returns. And I mentioned this Get Your Benefits project. We've been working for the past multiple years trying to help people understand that filing taxes is incredibly important for you to access benefits that you're eligible for. I always give the example of I was a big sister to a young man who in his last 2 years of high school had a CIBC, the bank fellowship, to give him some support in preparation for university, and then they were going to pay tuition. And as part of this support, they allowed him to get a job they got him a job actually at the Y, where he worked a couple of nights a week and then a couple of months during the summer. And after I understood how important tax filing was, I said, Joe, did you file your taxes last year? And he looked at me, he was just appalled. And he said, Norlu, I can barely get enough money to buy a coffee once a month. I don't want to give the government my money. I said, no, you don't understand. Every time you're working, they're withholding money, which you'll get back when you file taxes. And people just low-income people don't understand that filing taxes is not giving money to government. It's accessing benefits and getting money that's been withheld by 7-Eleven, by whoever's paying your small wages back. So I've gotten involved now in trying to let people know how important this commitment in the throne speech is. And we're trying to we found out who's heading the committee, trying to contact him, telling sort of Food Banks Canada, United Way, that this is an important initiative to be promoting and to be making happen. So taking advantage of opportunities, absolutely important. This has been a very special opportunity for me to think back over my career. And there's no question that Fraser Mustard, who was at one time dean of the medical faculty at McMaster, who set up, which is how I knew him, the CIAR, Canadian Institute for Advanced Research, which is now known as CFAR, was absolutely critical in connecting me with people across Canada and understanding the broader determinants of health, which is what we were working on. We were a population health group, and that's basically sort of what I learned from that. He was one of the most, no question, influential people in my career. Two other people I would mention, Henry Friesen, who was from Manitoba and recruited me to be on the Medical Research Council. And then when they were setting up the Canadian Institute for Health Research, recruited me to be on the organizing committee. He and Brian Postal, who is now the dean of the medical faculty at Manitoba and who was head of my department and worked with both of them in multiple roles. They are both two of the absolutely most skilled individuals at getting things done in complex situations, working with politicians, administrators, et cetera. So those are the three people, no question, I thank and were very influential in my career. Thank you. It's been a very interesting and rewarding experience. So thank you to your organization.